ꯇꯨꯡꯒꯤ ꯌꯨꯝꯕꯤ ꯍꯥꯏꯔꯒꯗꯤ ꯅꯍꯥ ꯑꯣꯏꯔꯤꯕ ꯃꯤꯑꯣꯏꯁꯤꯡꯕꯨꯅꯤ ꯍꯥꯏꯅ ꯑꯍꯜ ꯂꯃꯟ ꯑꯃꯗꯤ ꯑꯈꯪ ꯑꯍꯩꯁꯤꯡꯅ ꯁꯣꯟꯅꯗꯨꯅ ꯂꯥꯛꯂꯤ꯫ ꯃꯥꯂꯦꯝ ꯄ꯭ꯔꯤꯊꯤꯕꯤ ꯑꯁꯤꯗ ꯍꯤꯔꯝ ꯀꯌꯥꯗ ꯅꯍꯥꯁꯤꯡꯅ ꯂꯧꯔꯤꯕ ꯊꯧꯗꯥꯡ ꯑꯃꯗꯤ ꯂꯧꯔꯛꯀꯗꯧꯕ ꯊꯧꯗꯥꯡꯁꯤꯡꯕꯨ ꯃꯤꯄꯨꯝ ꯈꯨꯗꯤꯡꯃꯛꯅ ꯈꯪꯅꯕꯒꯤꯗꯃꯛꯇ ꯑꯥꯒꯁꯠꯀꯤ ꯇꯥꯔꯤꯛ 12 ꯑꯁꯤ ꯏꯟꯇꯔꯅꯦꯁꯅꯦꯜ ꯌꯨꯊ ꯗꯦ ꯍꯥꯏꯕꯗꯤ ꯄ꯭ꯔꯤꯊꯤꯕꯤ ꯄꯨꯝꯕꯒꯤ ꯑꯣꯏꯅ ꯅꯍꯥꯒꯤ ꯅꯨꯃꯤꯠ ꯍꯥꯏꯅ ꯄꯥꯂꯟ ꯇꯧꯅꯔꯤ꯫ ꯆꯍꯤ ꯑꯁꯤꯒꯤ ꯊꯤꯝꯅ ꯂꯣꯀꯦꯂꯥꯏꯖꯤꯡ ꯁꯁꯇꯦꯅꯦꯕꯜ ꯗꯦꯚꯂꯞꯃꯦꯟꯠ ꯒꯣꯜꯁ ꯑꯦꯟ ꯕꯤꯌꯣꯟ ꯍꯥꯏꯅ ꯊꯝꯂꯤ꯫ ꯆꯠꯂꯤꯕ ꯆꯍꯤ ꯏꯪ 2015ꯒꯤ ꯑꯣꯏꯅ ꯑꯥꯒꯁꯠꯀꯤ ꯇꯥꯔꯤꯛ 12 ꯑꯁꯤꯗ ꯗ ꯃꯅꯤꯄꯨꯔ ꯁ꯭ꯇꯦꯠ ꯑꯦꯗꯁ ꯀꯟꯇ꯭ꯔꯣꯜ ꯁꯣꯁꯥꯏꯇꯤꯅ ꯁꯤꯟꯗꯨꯅ ꯄꯦꯂꯦꯁ ꯀꯝꯄꯥꯎꯟꯗ ꯂꯩꯕ ꯁꯤꯇꯤ ꯀꯟꯚꯦꯟꯁꯟ ꯁꯦꯟꯇꯔꯗ ꯏꯟꯇꯔꯅꯦꯁꯅꯦꯜ ꯌꯨꯊ ꯗꯦ 2025 ꯑꯦꯟ ꯂꯣꯟꯆꯤꯡ ꯑꯣꯐ IEC ꯀꯦꯝꯄꯦꯟ ꯄꯥꯡꯊꯣꯛꯂꯤ꯫ ꯃꯅꯤꯄꯨꯔꯒꯤ ꯒꯚꯔꯅꯔ ꯑꯖꯌ ꯀꯨꯃꯥꯔ ꯚꯜꯂꯥꯅ ꯁꯤꯇꯤ ꯀꯟꯚꯦꯟꯁꯟ ꯌꯧꯔꯛꯂꯕ ꯃꯇꯨꯡ ꯁ꯭ꯇꯦꯠ ꯑꯁꯤꯒꯤ ꯃꯀꯣꯛ ꯊꯣꯡꯕ ꯑꯣꯐꯤꯁꯤꯌꯦꯜꯁꯤꯡꯅ ꯇꯔꯥꯝꯅ ꯑꯣꯛꯈꯤ ꯑꯃꯗꯤ ꯏꯟꯇꯔꯅꯦꯁꯅꯦꯜ ꯌꯨꯊ ꯗꯦ 2025 ꯑꯦꯟ ꯂꯣꯟꯆꯤꯡ ꯑꯣꯐ ꯏꯟꯇꯦꯟꯁꯤꯐꯥꯏꯗ IEC ꯀꯦꯝꯄꯦꯟꯒꯤ ꯄꯥꯎꯖꯦꯜ ꯄꯨꯕ ꯃꯣꯇꯣꯔꯁꯥꯏꯀꯜ ꯔꯦꯂꯤ ꯑꯃ ꯁꯤꯇꯤ ꯀꯟꯚꯦꯟꯁꯟ ꯁꯦꯟꯇꯔꯗꯒꯤ ꯃꯅꯤꯄꯨꯔꯒꯤ ꯒꯚꯔꯅꯔ ꯑꯖꯌ ꯀꯨꯃꯥꯔ ꯚꯜꯂꯥꯅ ꯂꯝꯊꯥꯈꯤ꯫
अधिनायक जय हे भारत भाग्य विधाता पंजाब सिंध गुजरात मराठा द्राविड़ उत्कल बंगा विंध्य हिमाचल यमुना गंगा उच्चल जलधि तरंगा तव शुभ नामे जागे तव शुभ आशीष मांगे गाहे तव जय गाथा जन गण मंगलदायक जय हे भारत भाग्य विधाता जय हे जय हे जय हे जय 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 हे।
ꯃꯅꯤꯄꯨꯔꯒꯤ ꯒꯚꯔꯅꯔ ꯑꯖꯌ ꯀꯨꯃꯥꯔ ꯚꯜꯂꯥꯅ ꯆꯤꯐ ꯒꯦꯁꯠ, ꯄꯨꯅꯤꯠ ꯀꯨꯃꯥꯔ ꯒꯣꯌꯜ ꯆꯤꯐ ꯁꯦꯀ꯭ꯔꯦꯇꯔꯤ ꯃꯅꯤꯄꯨꯔꯅ ꯄ꯭ꯔꯁꯤꯗꯦꯟꯠ ꯑꯃꯗꯤ ꯁꯨꯃꯟ ꯁꯤꯡ ꯀꯃꯤꯁꯅꯔ ꯍꯦꯜꯊ ꯑꯦꯟড ꯐꯦꯃꯤꯂꯤ ꯋꯦꯜꯐꯦꯌꯔ ꯒꯚꯔꯟꯃꯦꯟꯠ ꯑꯣꯐ ꯃꯅꯤꯄꯨꯔ ꯑꯦꯟ ꯄ꯭ꯔꯁꯤꯗꯦꯟꯠ ꯃꯅꯤꯄꯨꯔ ꯁ꯭ꯇꯦꯠ ꯑꯦꯗꯁ ꯀꯟꯇ꯭ꯔꯣꯜ ꯁꯣꯁꯥꯏꯇꯤꯅ ꯒꯦꯁꯠ ꯑꯣꯐ ꯑꯣꯅꯔ ꯑꯣꯏꯅ ꯂꯦꯡꯁꯤꯟꯈꯤ꯫ ꯊꯧꯔꯝ ꯃꯈꯥ ꯆꯠꯊꯔꯛꯄ ꯑꯣꯏꯅ ꯊꯧꯔꯝ ꯑꯗꯨꯒꯤ ꯆꯤꯐ ꯒꯦꯁꯠ, ꯄ꯭ꯔꯁꯤꯗꯦꯟꯠ, ꯒꯦꯁꯠ ꯑꯣꯐ ꯑꯣꯅꯔꯗ ꯑꯆꯝꯕ ꯈꯨꯗꯣꯜ ꯄꯤꯗꯨꯅ ꯏꯀꯥꯏ ꯈꯨꯝꯅꯕ ꯎꯠꯈꯤ꯫
And a memento, an especially curated gift basket filled with local produce for joining us. Project Director sir for doing the honor of felicitating.
International Youth Day 2025 ꯊꯧꯔꯝ ꯑꯗꯨꯒꯤ ꯆꯤꯐ ꯒꯦꯁꯠ, ꯄ꯭ꯔꯁꯤꯗꯦꯟꯠ, ꯒꯦꯁꯠ ꯑꯣꯐ ꯑꯣꯅꯔꯅ ꯊꯧꯔꯝꯒꯤ ꯃꯩꯔꯥ ꯆꯨꯈꯠꯇꯨꯅ ꯊꯧꯔꯝ ꯍꯧꯗꯣꯛꯈꯤ꯫
Where there is fear.
ꯊꯧꯔꯝ ꯑꯗꯨꯒꯤ ꯒꯦꯁꯠ ꯑꯣꯐ ꯑꯣꯅꯔ ꯁꯨꯃꯟ ꯁꯤꯡ, Commissioner, Health and Family Welfare, Government of Manipur, and President, Manipur State AIDS Control Society na welcome speech amadi keynote address thamki.
I extend a warm welcome to Honorable Governor Shri Ajay Kumar Bhalla. I extend a warm welcome to our respected Chief Secretary, Puneet Goyal sir. I welcome senior government officials of various departments, dignitaries, Manipur AIDS Control Society partners, NGOs, representatives of bilateral donors, nursing students, Red Ribbon Club members, friends from the media, ladies and gentlemen. Today we are observing the International Youth Day 2025 under the theme Local Youth Actions for the Sustainable Development Goals and Beyond. We are here to support incredible efforts of youth-led initiatives that are shaping real change in communities around the world. We also take this opportunity to reflect on the importance of frameworks like World Programme of Action for Youth, the Pact for the Future, and the Declaration on Future Generations. These global commitments remind us that local development is the strongest when youth voices are part of the design, decision-making and delivery. But visibility alone is not enough. We must move beyond celebration to concrete institutional support. We need to encourage civil society, the private sector and the academia to work with youth, not just for them. We need to promote inclusive policies that make youth participation not only possible but powerful. Today also will be launched the 2-month Intensified IEC campaign. The aim of the campaign is to increase comprehensive knowledge about HIV/AIDS, promotion of HIV/AIDS Prevention and Control Act 2017 to address stigma and discrimination towards people infected and affected by HIV/AIDS. The aim is also to create awareness of HIV and syphilis among pregnant women, ANC attendees, create demand for services such as testing for HIV, condom, STI services, and promote other services under National AIDS Control Program, including National AIDS toll-free helpline 1097 to strengthen collaboration between various government departments at state, district, block, and village level administration to promote awareness. HIV prevalence among various high-risk groups in Manipur has significantly come down from the year 2003 to 2021. For example, the HIV prevalence among injecting drug users, IDUs, has come down from 30% to 8%. Among antenatal clinic attendees, it has come down from 1.34% to 0.33%. However, Manipur is still one of the high HIV prevalence states in the country with 0.87% of total adult HIV 0.87% of the adult HIV prevalence. At this juncture, I would like to show some data which captures the trend of HIV/AIDS in Manipur. This data shows that efforts are bearing fruits. Sir, in this graph, the red colored dots, the dark line is Manipur's trend, and this shows the HIV prevalence, the definition of which is from year 15 to 49 years population, what is the percentage of people having HIV/AIDS. We were the second highest state in terms of this metric in 2010, and now we are still third highest. But the important part of this data is that among all states, this is the general population which is captured per 1,000 population, which is called HIV incidence. This is the general infection rate. Again we see, although other states also have the downward trend, some states have the upward trend, but Manipur has consistent downward trend where we are now below 2%. Again, this is a very significant metric where people living with HIV from 2010 to 2024. So this is the absolute number of people. Earlier we had about 30,000 people living with HIV/AIDS. And currently the number is now below 24,000 in the absolute number of people living with HIV, but Manipur has a downward trend. We were the highest, now we are fourth highest. So this is the ground we have covered during last 14 to 15 years. Again, this is AIDS-related death per 1 lakh population. We were among the highest. We were actually the highest number we had. This again shows the vertical transmission, which basically means the transmission from mother to child. In this metric also, all states are either stable or going upwards, except one state, but Manipur has a consistent downward trend. Now this is the last slide, sir. This basically is very important data point, which I will explain as follows. HIV/AIDS has been a significant public health threat in the world, in India and in Manipur also. So now we are moving towards removal or elimination of this public health problem. And then the question is asked that what is the threshold or the objective definition when we can say that the HIV/AIDS is no more a public threat. And one of the important metrics is if the new transmission rate is reduced by 80% from the current level and AIDS-related deaths, that is mortality rate, is reduced by 80% from the current level, then we can say that HIV/AIDS is no more a public health threat. To achieve that, the threshold which has been designed by the experts is this 95, 95, 95, that is triple 95, which basically means that when all the people living with HIV/AIDS, if 95% of them they are aware of their status, that is the first 95%. Then second 95% is from the first 95%, if 95% of those people are on the therapy or the treatment, that is the second 95%. And the third 95% is the suppression of viral load. From the second 95%, if 95% people have suppressed their viral load in their body, that is the third 95%. The target to achieve this 95, 95, 95 has been set for 2026. It is estimated by the experts and even its program that if we are able to achieve 95, 95, 95 by 2026, then by 2030 we will be able to achieve those ultimate thresholds by which we can declare that HIV/AIDS is no more a public health threat. But if we look at the actual reality, we compare it with our national figures. The first 95%, we are below the desired level, 95%, but we are slightly above India, the national figure, 86%, relative 85%. In the second 95, we are significantly below the national average also, that is close to 78%. And in the third 95, we have gone even above the desired level also. So we need to do a lot of work on the treatment and therapy part to achieve that 95%, and then we need to do some work on the first 95% also. Friends, today in today's program we also have a sub-component of TB Mukt Bharat Abhiyan, which is getting directly supervised by Honorable Governor. Today we will witness the launch of an AI-enabled advanced device for detection of TB. The AI-assisted portable X-ray machine are new tools that have revolutionized the TB screening world over. Now we are going to use them in Manipur also. Honorable Governor will distribute these sophisticated devices to our healthcare professionals today. With these few words, I once again welcome you all. Thank you very much.
Karmel Jyoti Kwarengaygi Mahiroi-singna isay ama khudol tamki. The Journey of Manipur State AIDS Control Society haina mingthonba short video amasung handheld X-ray ga mari lainaba short video ani mayam punna mideng taminaki.
In 1986, when India first heard of HIV, Manipur did not wait. It rose with urgency. A state AIDS committee was formed under the Chief Minister, a testament to its will to act. In 1990, Manipur identified its first HIV-positive case among injecting drug users. It was a warning and a call to action as AIDS had emerged as a new and serious public health emergency in the state. On 3rd October 1996, Manipur became the first state in India with its own AIDS policy, revised in 2015. In 1998, Manipur State AIDS Control Society, MATS, was born, becoming the vanguard of the fight towards HIV/AIDS. While some northeastern states show a rising trend, Manipur shows a steady decline over the years, testifying its resilience and leadership. The data reflects a promising downtrend in HIV prevalence across all monitored groups over the years. ANC attendees have seen a significant drop from 1.32% in 1996 to 0.32% currently, indicating effective maternal health interventions. Injecting drug users have experienced a dramatic decline from 64.13% in 1996 to 8.84% today, suggesting the successful harm reduction programs. Similarly, MSM, TG and the female sex workers have shown steady reductions, with prevalence falling to 9.43% and 1.13% respectively by the latest data. The results speak for themselves. This success is no accident. It is built on harm reduction strategies, rapid intervention and care, REACT, needle and syringe exchange, opiate substitution therapy, and robust IEC campaigns. Under IEC and mainstreaming, awareness regarding HIV and sexually transmitted infections, reproductive tract infections is imparted across all age groups through multiple platforms like audio and video spots in government and private agencies, social media, folk performance, participation in melas, events, school and college outreach programs, village level programs, interdepartmental coordination for providing services for persons living with HIV. To prevent HIV and STI/RTI among high-risk and bridge population, including prisons and other closed settings, prevention services are implemented by 53 targeted intervention NGOs and 9 link worker schemes. There are 59 centers in the state providing opioid substitution therapy, which involves giving prescribed medications to manage opioid dependence to reduce cravings and withdrawal symptoms. A total of 58 integrated and counseling centers, ICTCs, across the state provide free HIV counseling and testing services. Free HIV and syphilis testing for pregnant women is also available, including care for HIV-exposed infants and children. To tender to clients at risk for HIV and syphilis, Sampoorna Suraksha Kendras at RIMS, Jenims District Hospital, Bishnupur, Senapati and Ukhrul offer free health and non-health services in addition to HIV counseling and testing centers. Free antiretroviral drugs and complete care for people living with HIV are provided in 13 ART centers. Center of Excellence at ART RIMS is giving ART services for adults living with HIV and manages complicated cases. Pediatric Center of Excellence at Jenims is giving ART services specific to children living with HIV. Free universal screening and treatment of sexually transmitted infections, STIs, reproductive tract infections, RTI, are provided in 10 DSRCs. National Reference Laboratory NRL is located in RIMS Microbiology Department to provide quality laboratory HIV services. State Reference Laboratory SRL is located at Jennings Microbiology Department to provide quality laboratory HIV services. State Reference Center SRC is located at the Microbiology Department Jennings to give quality STI, RTI laboratory services. Data experts conduct regular HIV surveillance to monitor the National AIDS and STD Control Program, as well as carry out research activities. RIMS, with focal person from Community Medicine Department, provides support and guidance as the regional institute for the 5 northeastern states of India during HIV surveillance. In 1998, Manipur introduced REACT, the Rapid Intervention and Care Program, focusing on harm reduction, safe needles, condoms, and community-driven outreach. The program was replicated by other northeastern states thereafter. In 2016, Manipur became the first state in northeastern India to launch Project Sunrise, focusing on vulnerable populations through a positive network model, identifying and engaging social and sectoral networks to increase testing, treatment, and prevention. Again in 2022, MAX launched a family-centric approach under Project Sashakt, linking families to care, improving treatment outcomes, and leaving no one behind. Another first in northeastern states. In all of these, IEC remains the backbone, using mass media, folk theatre, and social media to fight stigma and inspire testing. From 61 active Red Ribbon clubs to youth-led campaigns, from classrooms to Instagram, MAX has embraced every platform to spread hope. With more than 37,000 subscribers on its YouTube channel, MAX has made digital outreach a force for change. Medicines can treat HIV, but only compassion heals stigma. The HIV and AIDS Prevention and Control Act 2017 gave legal protection against discrimination and stigma. In 2021, Manipur went further, appointing an ombudsman to protect the dignity and rights of a PLHIV. So far, Ombudsman Cell has registered 24 cases, and all of the cases were disposed of satisfactorily. The future lies in the hands that are fearless, hearts that are kind. Let the youth rise to end stigma, to end silence.
Let the youths lead. Let their voices be the change. Support MAX and our activities. Together, we can protect our future.
Together, we can end HIV. Together, we protect the future.
Tuberculosis is a silent communicable disease that claims over 3 lakh lives annually in India. In Manipur alone, 2,500 people develop TB each year and 125 succumb to TB. But the change is here. TB Mukta Bharat Abhiyan is on a mission to make India TB free by 2025.
जिस नई सोच और अप्रोच के साथ टीबी के खिलाफ काम करना शुरू किया, वो वाकई अभूतपूर्व है।
Manipur is rising to the challenge with AI-enabled portable X-ray devices, small yet powerful tools that are revolutionizing early TB detection, particularly in remote areas. Studies suggest that including X-ray in the screening can detect asymptomatic TB patients up to 30 to 60% more. These AI-powered devices, equipped with digital flat panel detectors, screen both symptomatic and asymptomatic individuals on the spot, slashing diagnostic delays. In In just one screening camp in Manipur, nearly 250 people can be screened per machine, a quantum leap forward. Till date, Manipur has screened nearly 4,000 individuals.
With this AI-enabled portable X-ray device, we are confident that we can screen entire Manipur's vulnerable population by the end of 2025, paving the way for a TB-free India.
Don't fear TB, fight it. With early screening and timely treatment, TB can be cured. Join us to make India TB-free by 2025. TB harega, देश जीतेगा.
Together, we can end TB. Screen today to eliminate TB. TB harega, desh jeetega.
Forum adugi saruk ama oina Manipur ki Governor Ajay Kumar Bhalana handheld X-ray yenthoki.
Deputy Commissioner, Chief Medical Officer, Loina District TB Officer, Lekhapiraknaba Narukjari. Masigi mathanda Kaching District ki CMO amadi DTO su simthakna lebinaba Narukjari. Representing Imphal East District, Masigi mathanda Kaching District ki Deputy Commissioner, Chief Medical Officer, Loina District TB Officer, Lekhapiraknaba Narukjari. Nation Birakani, Kaching District ki Representative Singh. Masigi Mathanda Thawal District ki Deputy Commissioner, Chief Medical Officer, Vinamina District TB Officer, Lekhapiraknaba Narukjari. And next we have Chandal District. We have Deputy Commissioner, Chief Medical Officer and District TB Officer of Chandal District. Masigi Mathanda Lekhapirakliba Churchandpur District ki SGO and D. Mathangi Asina Aroiba District, Kampopi District, District Program Manager and Team Lekhapiraknaba Narukjari. Thank you so much. Thank you so much, God.
Thoromadugi President Punit Kumar Goel, Chief Secretary Manipur na Thoromaduga Mari Lainana wafam khare thamki.
Friends from media, ladies and gentlemen, good morning to all of you. It is indeed an honor to join you all in celebrating International Youth Day 2025 and to mark the launch of 2-month Intensified IEC campaign for National AIDS Control Organization organized by Manipur State AIDS Control Society. The Intensified IEC campaign by Manipur State AIDS Control Society is about changing mindsets, building trust and saving lives. It is about reaching out, listening to the unheard and protecting the dignity and rights of every individual, especially those affected by HIV. It is about promoting awareness and literacy to address stigma and discrimination. Various activities at educational institutions, villages, government hospitals and special health camps, at relief camps aim to generate comprehensive awareness about HIV and AIDS. Sir, on this occasion, I would like to share some of my thoughts. As Commissioner Health said, that TB we will be able to eradicate from Manipur by December 25. As Honorable Prime Minister, we heard his message also. But our number, although it is declining in the AIDS, but still it is significantly high. Almost 30,000 people are affected out of a population of 30 lakh, which is a very high number compared to national average also. And Commissioner Health presented that 95 formula, 95% about the detection or awareness, 95% about treatment, and 95% about suppressing the virus. So why don't we take a pledge today that within this financial year, by March, we achieved this 95, 95, 95 for Manipur. And this is possible if all our deputy commissioners, chief medical officers, district AIDS control officers work in a mission mode. Today, that is the message we all carry home, and everybody present in this room work towards this goal. So I urge all the stakeholders to work collectively to achieve this goal. Together we can transform awareness into action, replace stigma with solidarity, and turn silence into support. Let us build an inclusive future where no one is left behind. Thank you. Jai Hind.
Thank you, Chief Secretary Sir, for your thoughtful address and for reaffirming our collective commitment towards achieving our goal. And now the moment we have awaited, the words and wisdom of our Chief Guest, Honorable Governor Shri Ajay Kumar Bhalla ji, along with the formal launching of the Intensified IEC campaign.
Makha chatharakpada thoram adugi Chief Guest Manipurgi Governor Ajay Kumar Bhallana thoram aduga mari lainaba wafam thambaga loinana August ki tarik 12 dagi October ki tarik 12 fauba tha ani chumna chathagadauba Intensified IEC campaign hogdokhi.
Sustainable development goals and beyond carries a very powerful message. Across the world, communities are facing challenges that are global in scale, like climate change, unemployment, health crisis, inequality. But solutions often begin right where we live, in our neighborhoods, in our own villages, in our own cities. The government only plays a role of a catalyst. We, the society, definitely needs to come forward and do. AIDS is one example, awareness. Finally, people have to come forward. Government can provide facilities, testing, everything, even now the treatment. But still, awareness, so people themselves, instead of hiding, need to come forward. The SDGs, the Sustainable Development Goals, set the world's agenda for better future. But the truth is, 65% of these goals are achieved locally. That's why empowering youth and at community level, it's not optional, it's essential. Young people are not just beneficiaries of development, they are agents of change. Rather, they are people for the future. They can innovate, they can mobilize their peers. When a local population comes together on the issues like waste management, clean water, health awareness, to name a few, it's often youth who step forward for solutions. As we move towards 2030, local youth actions will determine how far we go in achieving SDGs. Every project, every initiative, every voice matters. So today is not just a celebration, it's call to action. Let's listen to young people, invest in their ideas and support their leadership. Because when youth lead, communities thrive and the world moves closer to a just, inclusive and sustainable future. Today we are also here for launching the 2-month Intensified IEC campaign, starting from today till 12th of October, by the Manipur State AIDS Control Society, under the aegis of NACO, the Government of India organization. Today, we stand at a very critical juncture in our fight against HIV/AIDS. While our national HIV prevalence, as explained by Sumant, remains relatively low, but in absolute number, Chief Secretary mentioned that we are fairly high. In the graphs also within Northeast, we were top 2, then even now we are at the 3rd position. So what is concerning is the rising trend in HIV prevalence in certain states. And there are different multiple routes of transmission. While for Manipur we have decreasing trend up to 0.81%. Prevalence rate is still the 3rd largest compared to, we are just below Mizoram and Nagaland. Sumant, you showed 95, 95, 95, and Chief Secretary has given a very good slogan that let's pledge and do it. The most important component is the first 95%. where we need involvement of everybody. Unless that reaches 95%, even if the last component is 100%, whatever remains out of this 95 still remains, because the others are follow-up of this. Whatever we detect, then you treat, and then you sort of go ahead with the remaining other two verticals. So focus should be on the first 95%, we should try to reach to the extent possible. Chief Secretary has rightly asked the Deputy Commissioners, the CMOs, to come together, put it as a campaign mode, plan this thing. We'll ask the Health Commissioner to give his leadership to the whole campaign and see that we can touch this 95% as early as possible. Other verticals will follow without any problem, because government is having the wherewithal to deal with that. So we need to promote awareness on the routes of transmission, but promote literacy of the HIV and AIDS. Social media has definitely, it was shown also, Instagram, it has its own reach. Today's youngsters have a reach, they can be reached easily through social media, and I'm sure our people are using it very effectively. This thing for pregnant women also, we need to promote awareness through hospitals, through institutional deliveries, wherever it happens and all. To create demand for services such as testing, use of condoms, STI services, and promote other services. There's a toll-free helpline also, 1097, which is available to everybody. And we must strengthen collaboration between various government departments at different levels, state, district, block, village, to promote awareness. Our goal is simple, yet very powerful, to equip every individual with accurate information on HIV and STD, or the STIs, and fight the stigma and discrimination, whatever is perceived to it. It should not be anymore a stigma, because there is a system that the viral load can be brought to a level that it's not harmful. So it's a treatable kind of thing which we need to make people aware. So let's work toward build a better future where knowledge replaces our fear, where prevention and compassion go hand in hand. I mean, instead of speaking all these words, I should have gone with those children who sang the song and said that conveys everything for all of us. Let's make this world better for us, you and me. That's what they conveyed, and that's what perhaps at the end of it I would like to say. Let's all come together and make it a better place for you and me, and that you and me includes everybody, all people in the society. Thank you very much. Jai.
Together, let us promote knowledge, protect rights, and inspire action to end HIV. Every event is built upon the efforts of many, seen and unseen. Expressing gratitude on behalf of the organizers, I invite Sri Samim Ahmed Shah, Project Director, Manipur State AIDS Control Society, to propose the vote of thanks.
Loisinlakpada Samim Ahmed Shah, Project Director, Manipur State AIDS Control Society, na vote of thanks piki.
Addressing this function as the chief guest and launching our 2-month-long Intensified IEC campaign. Your presence today not only lends immense encouragement, but also reinforces the state's commitment to the cause of HIV/AIDS prevention, care, and awareness. Thank you once again, sir. My sincere thanks also goes to the Chief Secretary, sir, whose leadership and guidance has been a constant source of strength in the implementation of health programs across the state of Manipur. Thank you, sir. I am equally grateful to our Sir Commissioner Health for providing invaluable policy direction and unwavering support to the Manipur SAC's efforts in combating HIV/AIDS. Thank you, sir. A word of appreciation is also due to our collaborating departments, community-based organizations, NGOs, health professionals, and field workers. It is your dedication at the grassroots that will give this campaign its true meaning and impact. Special thanks to Sri Sanju Bachaspati Mayum, Secretary, Manipur State Films Development Corporation, who readily accepted in taking the pains to make this video shown today. I am grateful to all the invitees and members present here for showing your encouragement by giving your time to attend this function. Thanks to Director Mahur for providing this venue. Heartfelt thanks to Pakang riders for not only accepting our request for the bike rally, but also for a successful ride today, which is an integral part of today's program. I also thank the members of the media, both print and electronic, for their presence and hope that our message to fight HIV/AIDS is amplified in every corner of the state. your reach and influence will be instrumental in making this campaign a success.
पंजाब सिंध गुजरात मराठा द्राविड उत्कल बंगा विंध्य हिमाचल यमुना गंगा उच्चल जलधि तरंगा तव शुभ नामे जागे तव शुभ आशीष मा